Okay, hello and welcome everyone attending the World Innovation for Health 20. Welcome to the session brought to you by the International Federation of Medical Student Associations, IFMSA, on envisioning climate change in every curriculum. My name is Abdullah Al-Khafaji. I am the liaison officer for medical education issues of IFMSA, and I'll be glad to moderate this innovation lab. Today, I have very special and distinguished guests that you will meet very soon, and we will go through them one by one. So when we talk about medical curricula, we are generally talking about the future of healthcare worldwide. And for that, it needs to be always inclusive to all the components that will affect the health and healthcare in the future. Among those is the climate change. So allow me please to start with our first guest, Dr. Diarmid Campbell-Landrum. Dr. Diarmid is the head of the climate change unit at the World Health Organization. Dr. Diarmid, welcome and thank you so much for joining us today. It's a pleasure to have you. Dr. Diarmid, since COVID-19 emerged, there has been a huge global talk about a green or a healthy green recovery. And talk to us, please, about the role of integrating climate change and the health workforce education and the importance of that to achieve that green recovery.
Okay, well, thank you very much. It's an absolute pleasure always to work with IFMSA and to talk with you. So as you say, the world's attention is now focused very firmly on COVID, and rightly so. It's the most massive public health challenge that we've seen certainly in my generation. And yet, at the same time, the other problems that we have are not going away. And climate change is the one we not only see coming up on the horizon, but also already hitting us. And this slide is basically my summary image of 2020 as I see it, where you have the COVID crisis and the health services trying to respond to that and keep people safe, while at the same time we're seeing floods, we're seeing wildfires, we're seeing droughts across the world piling up the health challenges that we were already struggling with. So just in a couple of minutes, just to introduce why we think as we recover from COVID and just in general for the health services and the health professionals of the future, why we at WHO think it's so important, so critical that climate change is part of that story. From our side, we basically see two tasks for public health. One is to join the overarching societal need to drive down carbon emissions. All health depends on the health of the planet and the environmental services that the planet provides. So we have to get carbon emissions down, and we have to get them down fast. In order to meet the Paris targets and to stay within 2 degrees centigrade warming, ideally 1.5 degrees centigrade warming at maximum, this is the trajectory we have to be on. And yet the trajectory that we're on is so far off that. So health has to get behind this push to drive down carbon emissions. And we also think that we have something particular to contribute from the health community, because if we do this right, then addressing climate change is potentially the largest public health opportunity of the century. It's something we've said, it's something the Lancet has said, and we've said that the Paris Agreement is potentially the most important public health agreement of the century as well, because of these opportunities to protect health and promote health as we face the climate challenge. At the same time, we also need to protect people from the climate change to which we are already committed. Because of the amount of carbon that we've already put into the atmosphere and that we continue to put into the atmosphere, we're already seeing escalating climate risk to health. And the slide you can see at the moment is just the increased exposure to heat waves observed in the most vulnerable populations within the last 20 years or so. The big problem that we have is it's not just heat waves, it's also extreme weather events, it's also vector-borne disease, it's also waterborne disease. And ultimately, it's a survival issue for some countries, low-lying countries, small island developing states, low-lying areas will eventually be submerged by climate change unless we address it. That's why we also have to strengthen the health system in order to protect people's health from these risks as we drive down carbon emissions. So those are the two tasks that we have. There is a related task to that, which is that the health sector, healthcare, is now about 10% of the global economy. It's about 5%, contributes about 5% of global greenhouse gas emissions. So we also have a role in driving down our own carbon emissions, both because it's an important source of carbon, but also because we have a leadership role and we set an example to others. And I'll get onto that in just a minute. We also believe there's a massive equity issue here. Those populations which have contributed least to climate change are those which are most impacted and vulnerable to the ongoing impacts of climate change. This is true whether you look across countries or whether you look within countries. It's basically the poorer populations which have that higher vulnerability, and those are generally not the high carbon emitters. And we say this not to point the finger of blame at particular countries or particular populations. This has not happened on purpose. This has been a historical accident of the way we've developed. But we do say there is a shared global responsibility that we need to protect the most vulnerable. And so just the final couple of comments on why we think this the subject of this webinar is so important and why we're so pleased to engage with it is the role of the health community, and particularly young healthcare professionals. I've been involved in this field for longer than I care to admit. It's 20 years now that I've been working on climate change and health, and we've seen a gradual increase in this in the interest in this area from governments and from society as a whole. But it has really changed within the last couple of years, and that, I would say, has been mainly driven by young people's voices, whether it's in the streets or just getting engaged and talking with their peers. There is a new seriousness, I would say, now about the need to cut carbon emissions, and I'd also like to say that the health community has already been very strongly engaged in this. And I'd like to pay tribute to IFMSA, who we've now worked with for 10 years on advocating on climate change and health. And I think you and your cohort have a particular, a massive role that you're already taking up, and we just want to support you in that. We think it's massively important to connect the climate change and health stories. If you ask people in the street now, they are concerned about climate change in just about every population in the world. And if you put them on the spot and say, what are you concerned about in relation to climate change? And if you put health on the list, health usually comes out top. It's the issue that people are most concerned about. So we're supporting that. You mentioned in your introduction that as we build back from COVID and as we make these massive investments to prop up economies and to rebuild economies, we think it's critically important that those also support environmental protection, not because we're environmentalists, but because we're health professionals, and we know that without protecting the environment, then you can't protect health. So we have published this WHO manifesto for a green and healthy recovery with 6 prescriptions that we say countries should follow as they make these investments. We're also seeing really great progress. We've seen within the last month, the National Health Service of England, the largest single health service in the world, has committed to become net carbon neutral during the 2040s and has published a detailed plan to get there, and they're scaling up in order to deliver on that. But we're also seeing the mobilization both from the climate side and the health side, particularly amongst young people. And so my absolute final point is just to underscore the importance of the health voice. This is a slide I often show. It's public surveys of which professions do you trust most. And on the right-hand side, you can see the least trusted professions. They include estate agents, government ministers, politicians. On the left-hand side, you can see the most trusted professions. And you can see doctors are right up at the top, beaten only by nurses. So there is a real role for the health professionals, particularly young health professionals, in speaking up on this issue. And my final comments on this are, I think, to understand the reasons why the health professionals are so trusted. They're trusted because they're considered to be neutral on the environment issue. Their only objective is to protect health. They have clear values, which are about protecting other people. And also they're considered to be well-informed, intelligent and expert. And in order to really be intelligent and expert and to talk about what we know about, it is therefore important that health professionals do receive the information on climate, environment and health that allows them not only to integrate that into their own work, but also to act as trusted advocates for others. So that's why I'm so pleased to participate and to lend our support from WHO and to look forward to the rest of the discussion. Thank you.
Dr. Campbell-Lindrum, thank you so much in general for your continuous support, and thank you specifically for those amazing insights about the current status quo of climate change. And thank you for also presenting the WHO Manifesto for Health Recovery and emphasizing on the role of youth. We really appreciate your time. And now we shall move on to another distinguished guest of ours, Ms. Max Zimberg. Ms. Zimberg is the Member Engagement and Outreach Coordinator of the Planetary Health Alliance. Max, thank you so much for joining us today. It's a pleasure to have you with us. Tell us more about the global efforts led by multidisciplinary organizations to mobilize students for planetary health education, and more specifically about, as we heard, about the Planetary Health Ambassadors Program that you initiated, as well as the textbook on planetary health, and all those inspiring initiatives of yours. Max, you have the floor.
Sure. Thank you so much. And thank you, Dr. Campbell, for that wonderful presentation. It sets me up very nicely, as well as all the other panelists. I'm really happy to be here. I just want to bring in and set the stage a little bit on the planetary health lens, so we know what we're talking about when we use the term. And then, yes, I'll talk a little bit about some of those questions you asked. So I think it's important to note that over the past 50, 70 years, on paper, we've made these great gains in public health and global health by traditional measures like under 5 and maternal mortality, poverty, life expectancy. Of course, it's very different throughout the world, but overall. So when you look at any graph of that, and I didn't do slides today, but you see big increases there. And then the other side of the coin is if you look at any impact on our environment, we've done it at the expense of our environment. And so never before, I think everybody here knows, has our footprint and our impact on the earth been so expansive, transformative, and destructive, really. So with the planetary health lens, we like to use the term global environmental change because it includes climate change, but we also want to make sure some of the other changes and transformations to our environment are being encompassed. So that's things like shifts in loss of biodiversity, changing biogeochemical cycles, which includes carbon, but also nitrogen, phosphorus, and others, changes in land use and land cover, global pollution of our air, water, and soils, natural resource depletion, and then of course climate change and all of the effects that come with that. And so the crux of planetary health is really that all of these global environmental changes come and affect our health, often in very complex and interconnected ways. So it really expands everything from, of course, infectious zoonotic disease, as we're seeing right now, non-communicable diseases, nutrition, mental health, conflict, civil displacement, all of that. So I think what's really important, as Dr. Campbell highlighted so beautifully, is that the global burden of disease in the next century, coming decades, is going to be created by this global environmental change and by these, planetary health impacts. So, it's therefore so vital that health students and truly all students, because, health matters to everybody, become educated in these effects. Something special about planetary health is that, a few things. One, it's a relatively new field, right? It pulls from very long-standing concepts that are very aligned with many indigenous ways of thinking around the world. But as a field and movement, it was really forged in this moment of urgency. And also in response to this unprecedented scale of our impact on the planet. And it's also very solutions oriented. So, transdisciplinary, all about collaboration and shared values. So I think these are some of the important reasons why we would love to see planetary health, implemented into every curriculum of medical students and really students of all kinds. This notion of transdisciplinary collaboration. We've published a couple of years ago the 12 cross-cutting principles of planetary health, which I can put in the chat, but it talks about things like understanding bias, the difference between inequality and inequity, as Dr. Campbell shared, the role of governance, what it means to be a global citizen and have collective values, and really working together. So I think, for so long, medicine is often seen and students are being taught about symptoms and disease pathways and a very sort of, in the body kind of narrow view sometimes. And I think we're at a point now where our world is just so interconnected and we're seeing these effects right now that it's so important for medical students to be taking that more ecological view, of course, because of our not just social but ecological determinants of health, but really to be empowered young people and to be, not just trying to mop up the floor while the faucet is still on, but really trying to be a change maker and get to the root of the problem, even if, your work is, more on the clinical side. So I can speak a little bit about some of the programs and offerings that's happening at the PHA. So the Planetary Health Alliance, for those who don't know, is a consortium of over 200 organizations from over 50 countries now. And it's really, about this exact thing of coming together from different disciplines, worldviews, geographies, generations, and coming together with shared values to try to achieve planetary health in a really equitable and kind of local to global way. So some of our key programs include education, community building, outreach, and then really translating this into action. So what this looks like, we have certain affinity groups that have just formed really organically, and we're always looking for our community to create those new gaps. And probably one of our most exciting and popular ones is the Clinicians for Planetary Health group, which a lot of IFMSA folks are a part of, that we're really excited about. And as Dr. Campbell showed that perfect graph that we like to show a lot about how clinicians are always considered the most trusted professionals in society, and they touch just about everybody. So they're really these very, very powerful planetary health messengers, really. So we have our Clinicians for Planetary Health initiative, our Next Gen network, which the why there is very clear, why it's so important to be educating and empowering the next generation and having everybody really taking this planetary health lens, in the sense that they're able to see interconnections, to do this systems thinking, and take up some of the values for both people and planet. And lastly, yes, you mentioned the book on planetary health that was co-edited by Dr. Sam Myers and Dr. Howie Frumpkin, with a bunch of collaboration from other authors, and we launched that earlier this year. In tandem with an anthology of case studies that are free online, and these really show real life examples of what it means to take a planetary health approach. And throughout those case studies, you see the role of doctors, physicians, nurses, clinicians, and you can see kind of where those people fit in the larger planetary health solution building. So I will stop there for now, and thank you all.
Thank you so much, Max. You have stated amazing facts about climate change and the urgent role of planetary health as a tool to navigate the solutions for the crisis, as well as the important role of engaging youth in this global movement. Thank you so much, Max. And our next speaker is Ms. Omnia Lamarani. She is the Liaison Officer for Public Health Issues from IFMSA. Omnia is the one responsible for coordinating and navigating the efforts on planetary health, as well as climate change in IFMSA. Omnia, if you can please let us know more about student perspectives and IFMSA efforts. You have the floor.
Perfect. Thank you so much. And I'm really excited to be part of this panel and share what IFMSA has been doing, but it has been really inspired by the work that everyone here is doing, by the work of WHO, the Planetary Health Alliance, but also the inspiring efforts we're going to hear about more after me. But I would really like to share how IFMSA started. We've been advocating for climate change and health for more than a decade, as Dr. Campbell mentioned. And we realized throughout our advocacy that we, as future doctors, we will be among the first line responders to patients that are either coming with asthma due to air pollution or heat stress due to increasing temperature, or they can be coming with an acute injury due to an extreme weather event. And most importantly, they can also be coming with malnutrition due to crop failures, like we can see in many countries. But many medical students like myself, they are unaware of these health impacts due to climate change, and their medical curriculum does not provide it. Not providing us with the necessary information to respond appropriately and effectively to these patients really leaves us unprepared to address the climate crisis. And not providing us with this necessary education would also leave us unprepared to address both the needs of our patients and the needs of our communities. So in order for us as IFMSA to create that evidence-based sense of urgency for curricula worldwide to take a change, to make a change, to redesign their curriculum and the way that they set their modules in order to integrate elements of climate and health, we decided to conduct a global survey. We started in March 2019. We asked medical students coming from 112 countries. We asked them 3 simple questions. How many medical schools do you have? How many medical schools in your country has mention of climate change? And how was it mentioned? So after conducting a comprehensive analysis, we discovered that only 15% of these countries of over 2,000 medical schools asked had a mention of climate change. But what's even more interesting is that mention that 14% of them said that they had at least one lecture every year related to environment, health, or climate change. 14% of them said that they only had one lecture 1 year of their entire medical school that had a mention of environment and climate change. But the biggest majority of them all said that they either had a non-mandatory lecture or case study, or even a student-organized session on climate change. And this really shows the alarming gap between climate change and our medical education. And it also shows that even if it is mentioned, it is inconsistent. We also conducted another survey this year because we wanted to maybe examine a more specific topic, which is air pollution, because of its evident interlinkages between many curricular modules that we take. And we had only 92 countries participate in that second survey. And we discovered that less than 10% of them had air pollution mentioned formally, and even a less percentage of 5% had air pollution mentioned as part of a student-led activity. So this also shows that future doctors, they're not taught enough about the leading cause of death of more than 7 million people per year, which is air pollution. But I'm here to, rather than call for an urgency, like to share what we have done as IFMSA so far. So with the air pollution survey, we had the opportunity to work with the WHO Air Pollution Department. Together with them, we're creating a map on their website that will show these 92 countries and the situation in each country. And at the same time, they have involved us in developing a training of trainers manual for healthcare professionals and also medical students to learn how to integrate knowledge related to air pollution, both in their clinical practice, but also in their advocacy efforts. Also at IFMSA, we created a small working group to create our own medical education framework for climate change. This was inspired by another manual that we developed in 2016 with WHO Climate Change Unit. And this manual really paved the way for us to create a roadmap for a medical curriculum to integrate competency domains related to climate change and health in the curriculum. So we're basically not asking much of medical schools. We want them to integrate the knowledge that we are going to formulate directly into the curriculum with learning objectives. We also created a set of assessment scorecards, both for faculty members as well as students, to assess how are they learning about climate change, are they satisfied, do they have any further suggestions, and for faculty members to assess how frequently do they mention health and environment and climate change, and how consistent is that mention. And finally, I have to also share another project that I'm very excited about. We have collaborated with 6 top European universities, as well as the European Institute of Technology. And together with them, we created an online course for medical students specifically on nutrition for health and sustainability. Because we had the opportunity, as we all know, next year is going to be the UN Food Systems Summit, which is the first summit that addresses food systems. And we want to present the findings and the efforts and what has been the result of this nutrition course. So far, we have around 101 medical students registered, and we're starting by the end of this month. So finally, I'm going to end my intervention with an invitation to everyone who's watching and to my fellow panelists for you to really work with us in order to shape a well-equipped health workforce that is able to protect and also promote our health and the health of the planet on which we depend on. Thank you.
Thank you so much, Omnia. You have presented us with eye-opening insights about the status quo of climate change and its integration in medical curricula worldwide. And I'm sure that when I say this, I speak on behalf of all IFMSA members that we are very proud of all the efforts that you have been doing on climate change, on planetary health, and all the other public health domains. Thank you so much, Omnia. And now we will move on to talk about a bit of national efforts led by students worldwide to promote planetary health and integrate climate change in curricula. And our speaker here, Mr. George Kitching. Mr. Kitching is the co-chair of the Canadian Federation of Medical Students Health and Environment Adaptation Response Task Force. Mr. Kitching, we have heard about the report card that you have recently produced on this very specific matter. Can you please brief us about your initiatives? You have the floor.
Sorry. Can you see my slides?
Yes, perfectly.
Okay,
it's
great.
Loading now, I think.
Okay.
Still loading.
Okay, 1 second.
Yes, it works now.
Okay.
Yes, please, you have the floor.
Good. Okay, so I will just run through a bit about what where I'm coming from. My name is George. I'm a senior medical student at Western University in Canada, and I'm one of the co-chairs of the Health and Environment Adaptive Response Task Force, a task force set up by the Canadian Federation of Medical Students. A bit of background: the Canadian Federation of Medical Students represents medical students across Canada, about 8,000, and they have various portfolios. In 2016, they determined that they needed a task force to work on integrating climate change into curriculum. This task force was given a mandate to develop a set of core competencies for integration and then to work towards that integration. The HEART task force has changed over the past 4 years. We have expanded with increased interest from medical students across Canada. Currently, we have 2 co-chairs and 8 committee members. And then in the last 2 years, we have expanded even further to developing a network where we communicate with Canadian medical students. Now, I want to speak a little bit about our particular efforts around Canadian medical education, because we talk a lot about how to integrate this into curriculum, and many people that we have spoken to who are doing this in other places, and one of the first steps we have identified that many take is to develop core competencies. What will we teach? And so I heard that many institutions and universities have and student groups have developed core competencies of what they think needs to be incorporated. And then the next step seems to be that many go through a process of evaluation to see what is being taught right now. So after developing our core competencies in Canada, we went through a national evaluation of 17 medical schools, and we found varying results in terms of what schools are engaged in. Some have specific classes, and many did not. So there is a large room for improvement. We leveraged that report to engage in a series of meetings with deans at each medical school, sort of, and we use the network of medical students across the country to engage with their own deans at their own institutions, in the hopes that they could put some pressure using this report, this evaluation report, put some pressure on their deans to incorporate some of those core competencies. We have a plan in the next year to do a reevaluation, because we've heard that there has been some success from various schools in terms of movement in their curriculum. At my own institution, they have developed some lecture series that they will begin to integrate this coming year. In this process, what we have recognized is that it is not enough to just develop a curriculum and then try and get that implemented. We need to help medical educators recognize the importance of this. And that's why in this slide I have branches to accreditation and licensing. So as a medical school that is determining the curriculum that they need to teach medical students, they are looking at the final licensing exam, for which, at least in Canada, all medical students have to go through to become physicians. So all medical school students have to go through the Medical Council of Canada's licensing exam. The objectives that the Medical Council of Canada produces directly determines the questions that are on that licensing exam. And the majority of medical schools build their curriculum based on those objectives, because they need their students to pass that exam to be licensed. So what we've done now is the HEART Committee was asked earlier this year to develop objectives with the Medical Council of Canada relating to disaster preparedness. We took that opportunity to recommend a second set of objectives related to planetary health. And I actually spoke with them yesterday, and they were very, very keen on the objectives we had developed around disaster preparedness, and we're very interested in the planetary health objectives, and we're in the process of doing some more work around what could be included in that. But that was a very positive step for us, because if we can get these objectives into the licensing exam, then this is something that all medical schools will see the impetus for this. Because one of the things we get back a lot in terms of feedback from schools is that there isn't enough time, the curriculum is packed, this sort of feedback. And it's through these recognized channels of the licensing exam that we can sort of push them to see that, it's not just medical students who want this, this is also the licensing body wants this as well. And then we come to accreditation, and this is the other aspect of this sort of three-pronged approach that we have taken is all medical schools in Canada are accredited through the Committee of Accreditation for Canadian Medical Education. And the accrediting body accredits the medical schools to teach and provide MD degrees to students. So one aspect that we have also taken is to approach the Committee on Accreditation and sent them a letter to include planetary health as part of the accrediting standards for medical schools. And so this is another way of sort of pushing medical schools to recognize the importance of this, because now not only do they need to teach, and we have shown them what they could teach, they have to teach it for the licensing exam, but they also have to teach it because if they do not, then they may risk losing their accreditation as a medical school or going into some sort of probation. So this is the three-pronged approach that we have taken. We have developed core competencies for medical schools to integrate. We have evaluated schools and used that to push them in a student-led effort, and we have a plan to reevaluate because we have a feeling that there has been movement, some success so far. And then we have the licensing exam, the objectives that we are working towards, and have spoken with the accrediting body. So we are hopeful that in the next few years we will see some major shifts in the way that medical schools are thinking about this issue and how they are preparing to integrate it into their curriculum. So with that, I will say thank you so much, and yeah, great.
Thank you so much, George, for those beautifully presented facts and stats from the Canadian medical education context. And on the same domain of national student-led efforts, I would like now to give the floor to Ms. Silvia Hartmann. Ms. Hartmann is the Planetary Health Academy Coordinator at German Climate and Health Alliance. Please brief us about your efforts in 5 minutes if possible. Thank you so much. You have the floor.
Thank you. Thank you very much. I think that should be possible. Okay, and Omnia is trying to share the slides for me. So thank you very much for the opportunity to share our concept of education here. I've been engaged in this topic on climate change and health already for several years as well. First through IFMSA and now through the German Climate Change and Health Alliance. And I'm really happy to finally see real progress is being made. And I think this session is just yet another sign of this. So my name is Silvia Hartmann. I'm not a student anymore. I actually finished my studies in December last year. And so I'm a medical doctor and vice chair of the German Climate Change and Health Alliance. And in the following minutes, I'm going to present you how we in Germany are trying to introduce planetary health into the curricula. And as I said, we're not only medical students actually in our organization, but also rather like a network of people from the healthcare sector. Omnia, does it work with slides?
Yes,
your slides are moving.
Cool, thanks.
Yeah.
That's the perfect slide actually for right now. So our organization, the acronym is CLUG, was founded in 2017 by doctors, nurses, public health professionals, and students with the aim to promote climate action to secure human health. And in the last 3 years, many things happened actually in Germany, and we made huge progress that we didn't think would be possible back then. CLUG is an NGO with people and organizations as members, and we're in touch, for example, with the German Medical Association, several federal ministries, as well as renowned medical, or not only medical, but renowned research institutions, for example, the Helmholtz Institute or the Lancet Canton, with whom we are going to present the German policy brief in December as well. Next slide, please. And besides, we initiated Health for Future as a grassroots movement. Health for Future is the movement where doctors, students, and nurses are able to act as change agents in more than 50 local groups all over Germany. And our philosophy is from knowledge to action. So we agree with the premise that there is a lack of education in planetary health, and yet at the same time, in the broader public, there's still a lack of action and this lack of feeling of self-efficacy. And therefore, we actively encourage our people to, or change agents to become creative and induce the change they really want to see. So our approach to planetary health education is twofold. If you could go to the next slide, please. The one with the arrows?
Yeah.
Can you see? Okay, I can.
Yeah.
Okay, don't worry. So our approach is twofold. So it's bottom up and top down. As a top down approach, we're in close contact with the national institution responsible for exams in medicine in Germany and include planetary health into the competency-based catalog of learning outcomes. And as soon as the topic is included in this catalog, which is going to be like in around 4 to 5 years, questions on the topic of planetary health can occur in the national state examination, which means that then at the latest university will follow suit and implement planetary health into the curriculum. But there's also the bottom-up approach, and that's on the next slide, please. Because as long as this competency-based catalog is not implemented, there still is lack of education in medical curricula. And we decided, instead of solemnly highlighting which universities are not offering the models, that we're also going to offer actually our own model. And therefore, in spring 2020, we introduced an educational program called the Planetary Health Academy for students and everybody else interested in planetary health. And next slide, we invited international and national experts from the field, like, for example, Johan Rockström, Nick Watts, and Sabine Gabrisch, and many more to speak in our 9 weeks long online educational program. And one special aspect to mention is that we connected this work to our local groups. And interested people could directly get in touch with people on the ground, so to say, and engage in discussion. And this way, no one would have to study alone, but immediately could come into action with the similar thinking peers. Our lecture series was a really huge success. Over 4,000 people registered, and on average 1,000 people attended a lecture each week. Some medical faculties even credited participation with ECTS points, and as a result, now students who participated are now establishing also their own modules at their university. Next slide, please. Yesterday, we started our second edition of the Planetary Health Academy, and this time all the lectures will be in English. If you're interested, you can find more information and still even register on www.planetary-health-academy.de. And next slide, as in previous series, we're still inviting people from different disciplines and to share their knowledge. Like, for example, yesterday, Samuel Myers or Courtney Howard, but also people from other disciplines like Jennifer Cole, who's an anthropologist, Kai Spiekerman, who's professor on political theory, or Anna Dyson, who's professor of architecture. And this way, through this online format, we are making planetary health education available for many more people compared to only establishing a single course at university, which is still really important, but we're aiming for the fast progress being made and just like spreading the message. Next slide, please. And we're really, really proud that for this time, the lecture, people from 73 different countries registered. And like last time, participants get always a certificate, and doctors in Germany can even apply for CME credit points. So next slide, please. I hope this gave you like a short and quick input from our work and maybe even some inspiration for your own work. And please don't hesitate to ask or any questions or contact me under the email address. And I'm really happy, to share this. Thank you.
Thank you so much, Silvia, for those amazing facts from the German context, and thank you for briefing us about your work in the Planetary Health Academy. Thank you so much for joining us today. And moving on to our last speaker, Ms. Kathy Wapnitz from the Department of Public Health and Primary Care, University of Cambridge. Kathy, we heard about this very inspiring idea, a pledge for planetary health to unite current and future health professionals. Could you please brief us about this initiative? You have the floor.
I think, unfortunately, she's not able to join us.
Oh, okay, in that case, we can move on to questions. We have received some very interesting questions from our audience today. So a question here is, how can younger people educate their elders in a lot of contexts, such as ours for today? Is it on a household-to-household basis? Is this considered a good start? If any of our special guests would like to take the lead on the answer, please feel free to take the floor.
I can say just a couple of words. I think that is a particularly important avenue. And I'll give you one bit of evidence and then one anecdote. The evidence is that I understand there is good evidence that the most efficient, most effective way to get adults to give up smoking is to have their children tell them they need to give up smoking because they don't want them to die early and not see them grow up. So that avenue of having young people educate older people is a highly effective one. The other is anecdote. I think one of the successes of the Fridays for Future movement has been basically to not let people get away with nonsense, not to let them get away with just making bland promises, and to actually hold them to account and to say, yeah, you say all this stuff, but Greta Thunberg is absolutely fantastic about saying yes, but you're not doing enough and not letting people off the hook. The anecdote there is that within my own family, I work on climate change. I have children. They hadn't paid a lot of attention to what I was doing. When that movement appeared, suddenly, they turned vegetarian, we turned vegetarian, and suddenly we have a much sort of lower environmental footprint. So I think thinking carefully about how you engage through that audience is a really important and effective mechanism.
Thank you so much, Doctor, for the answer. Thank you so much. And we can move on to another question. I think we still have a bit more of the time. So in regards to updating medical curricula to account for climate change, are there any case studies or example where this has been implemented successfully? If so, what changes have you noticed? Maybe Omnia or any of the other student-led organizations that are joining us could take the answer for this question. Please, very quickly and briefly.
Yeah, I can just say 2 sentences because we already saw what Canada has been doing and George can elaborate. But when we were doing our study, we actually wanted to know whether anyone was successful to actually do that. We realized that there was a couple of countries that had student-led movements. One of them was actually in the UK. They are now working with the GNC within the UK to try to mobilize this movement. It's not yet shown whether it has been integrated or not, but there's a huge movement there, and also in Australia. So these 2 countries have very inspiring student-led efforts regarding curriculum, but now I'll leave the floor to George.
Yeah, I would echo that Australia has some very good students working on this. And in Canada, the evaluation that we conducted, we found that some schools had incorporated specific lecture series related to air pollution, as was discussed earlier, or congestive heart failure, heat illness. But one of the interesting ones that I thought was particularly relevant was the Northern Ontario School of Medicine in Canada. They have a very rural sort of group of communities that they support through medical learners, students who visit these communities for a period. And one of the things that we found was that the school itself had developed a requirement for students to produce an essay reflecting on how climate change was impacting the community that they visited. And so that one stood out among all the schools in Canada as one that was particularly reflective in terms of getting students to really engage with how climate change was affecting the community that they were visiting. And these were northern communities in Northern Ontario. So are really within Canada at the front line of changes due to climate change. Yeah.
Thank you so much for the beautifully phrased answers. Another question, hospitals and labs emit 4.4% of the world's greenhouse gas emissions and are responsible for more than 5 million tons of waste each year. Is there a way to attempt to tackle this through medical and healthcare management curricula? Feel free to answer for any of our distinguished panelists.
Maybe I'll start just with the sentence. I actually think yes, and it's really unfortunate that Catherine Wapnitz could not attend because her pledge is like directly aiming at this. Like in medicine, we were taught to heal people, not considering what kind of impact our own work has on the environment while we send them back. So I think definitely there's this possibility, and the pledge is one like with which we can start. And if you haven't seen it, you should check it out.
I will just add a quick, one thing that I have not mentioned that the HEART committee that I'm part of has been engaging in is we've received funding through our national student body to engage in a series of quality improvement projects for the healthcare system in terms of making it greener. We call it Project Green Healthcare. So in this autumn, in September, we had student groups from across Canada apply with projects to receive some of this funding. And this is a 2-year program. So the quality improvement projects will run for 2 years and will be evaluated and have support of physicians at each institution who will sort of mentor those student groups as they go through the projects. And I know this is not exactly integrated into the curriculum yet, but many Canadian medical schools have quality improvement projects like embedded already in their curriculum. So we are thinking that that might be one avenue to sort of push them to have sustainability-minded quality improvement projects.
All right, thank you so much for the answers, everyone. And I think we have one additional minute for a last question, and it's also for Mr. Kitching. The question says, have you received any pushback in altering the accreditation system in Canada? If so, what were the stated reasons for that pushback, and how did you work around it? In 1 minute, if possible, please.
I'm sorry, there isn't much of an update. We have reached out and when we are expecting an answer, and we will hopefully meet with them. So they have not said no yet, but they also have not said yes. So we will continue that work. Yeah.
Perfect. Thank you so much. Okay, so our session today has reached to an end. Please allow me to thank all the amazing panelists who have joined us today and all the people who have watched our session. Thank you so much. COVID-19 was an alarm and as an opportunity at the same time. So let's all use the lessons learned from this pandemic. Let's act, and let's act now. We in IFMSA call all the relevant stakeholders to engage youth in this movement as the main beneficiaries of its impacts and outcomes. Thank you once more, everyone, for joining, and we hope to see you soon. If you have any additional questions, feel free to approach us through the WISH platform. Thank you, everyone. Hope to see you soon.
Thank you so much to all the organizers and panelists.
Thanks, everybody.
Thank you.
Yeah,
Thank you for being with us.